All right, tonight, NBC News is reporting more than 5,200 confirmed cases across the United States, and there are nearly 100 deaths.
Today, the Federal Coronavirus Task Force emphasized increasing testing is still one of its top priorities. 11 Live's Latasha Givens has the big takeaways from the White House briefing.
During the White House briefing today, the president, as well as the Coronavirus Task Force, spoke at length about some of the top concerns about how the administration is responding to the pandemic. They focused on testing, prevention, and resources being offered to the public.
The Coronavirus Task Force making it clear it's still focused on increasing the ability to test for the virus. So far, public health labs have conducted 31,878 tests, with clinical labs reporting 27,000 tests. That amounts to about 60,000 tests in the U.S., where the population is about 327 million. For comparison's sake, South Korea says it's tested about 250,000 people among its population of 51 million. Italy has tested 73,000 for its population of about 61 million. To help increase access in the U.S., the task force says it's setting up 47 drive-through labs in 12 states, like what we've seen in Colorado. But the Trump administration says you shouldn't just rely on a test.
Public health laboratories, meaning the CDC and the public health labs, have reported out 31,878 tests. So,
regardless of testing, they're urging people to maintain social distancing and avoid groups larger than 10 people.
Testing should not be used as an assessment of your risk.
They also addressed accusations the administration turned down testing kits from other countries.
nothing was offered that we refused. It was a research test that was not approved.
Dr. Deborah Birx went on to say all testing from any source must be submitted to and approved by the FDA, and some of those tests in question did not meet U.S. quality standards.
Other tests that were utilized around the world were not of the same quality, resulting in false positives and potentially false negatives.
To reduce exposure, the task force says it's working to expand telehealth services for 62 million Medicare subscribers.
Medicare beneficiaries across the nation, no matter where they live, will now be able to receive a wide range of services via telehealth without ever having to leave home.
The task force says that will free up staff for priority patients as well as preserve protective medical equipment.
They're also considering relaxing some of the HIPAA restrictions, like what medical information can be discussed over the phone and allowing doctors to use their own personal phones to share information faster.
All right, makes sense as people need information as quickly as possible. Latasha, thank you.